Mental health and behavioral health for a pediatrician who doesn't have resources to provide and doesn't feel prepared to address it is a huge factor in burnout. And whether you call it burnout or you call it moral injury or you call it frustration, I very clearly remember several weeks ago, I showed up in the office and I opened up my schedule. We're not a super high volume practice, but my day I had 15 kids scheduled with lots of gaps for acute care. Obviously, I wasn't going to end with 15, but I started with 15, and 9 of those 15 were ADHD, anxiety, school problems, some behavioral concern. And my experience on that day is not that different from the experience of most pediatricians. And we're seeing a third to a half of the kids on the schedule are coming in for a primary behavioral health diagnosis. They're coming in for checkups, their yearly checkups, and there is a mental health diagnosis. I practice in Marin County. We already talked about the demographics of my practice. I just finished doing 2 weeks locums in Arizona on the Navajo Reservation in a town called Kansas City, which could not be more different from my practice in Marin County. But the issues were exactly the same, just to a much, much higher degree with far fewer resources. And so this is everywhere, and it's leading to a ton of burnout. All three of us practice the 4 hospitalists, right? You remember leaving the office in the middle of the day to go to a C-section and standing there while the tracing got better, and then you'd run back to the office and there were patients who had been waiting for an hour and a half because you were at the hospital for the C-section or resuscitating a baby and getting them stable. How happy were you when you suddenly could stay in the office because there was somebody who knew what they were doing, who could take better care of that baby because they were doing it every day and took care of it at the hospital, right? Your patients got better care. You did what you did best, which is just doing checkups and vaccines and acute care, and you could sleep at night. Having behavioral health integration is going to help me recruit the doctors. It's going to help me keep doctors. It's going to help me practice longer, and it's going to provide so much better care for my patients. If that costs me a little bit every year, then maybe that's worth it, right? And again, I'm trying to dismiss that this is really financially challenging for practices with a lot of Medicaid, but how much money and time do you spend recruiting doctors or having doctors who need more time off, who need more vacation time, or retire? How would the rate of early retirement after the pandemic? It was significant.
Yeah, the average pediatrics is a women's specialty now. I think some like 80% of graduating residents are women. And they're lasting, the average about 7 years post-residency, and then they quit. They don't want to have anything to do with the exam room, which is just alarming because all the resources that have gone into creating a pediatrician, and all of that is just lost in 7 years. And of course, it's every week. You walk in, 3 kids with physicals. The one kid, the twins, the 6-year-old, one's got asthma and was extremely premature and snores at night. The male twin bounces off the walls. And when you tell the mom, is he having trouble in first grade? Nope. Are you getting called because he's not completing his assignment? Nope. Is he disrupting school class? Nope. So he just behaves like this at home? Yeah. I'm like, then it's a discipline problem. You had 6 kids, no car, no money, no job. You're doing the best you can. Until the school complains, we don't need to address it. And she started crying. I'm like, oh my God, what did I do wrong? She's like, all their kids are calling him autistic. I'm like, no, he's hyper. He's hyper. But if it's not causing problems in what his job is, which is school, and you can deal at it from your perspective at home, we don't have a problem. He's growing. He's getting the best we can do. And then the next kid, the teenager, 300 pounds, BMI 40, of course, PHQ-9 off the charts, not going to school. And that's those 3 scheduled at once, right? And it's like, George wouldn't care. He would just walk out of the room like, not my problem. But for most of us, You go home and your heart hurts and your head hurts. I'll order the labs. He's probably pre-diabetic. I know I can't put him on a GLP-1 because Medicaid won't pay for it. What do I address before his struggle with weight or his depression, or is he depressed because he's obese? What do I do about his school avoidance, which was hurt by, you said it, I laugh at social determinants of health. We've known that whatever your social circumstance is affects your health because the number one determinant of how long you'll live is your zip code. And that's been around for 50 years.